Ear infection is also known as acute otitis media. Otitis media is an infection of the middle ear. Most of the time, it is caused by bacteria that nearly all children have in their nose and throat. Ear infections most often develop after a cold or the flu. Viral respiratory tract infections change the pressure in the middle ear, like when you are flying in an airplane. Fluid may form in the middle ear and bacteria and viruses follow. Symptoms include sudden ear pain and temporary hearing loss. Fever. Pulling on the ear. Irritability or restless sleep. Decreased activity. Lack of appetite. Vomiting or diarrhea and draining fluid from the outer ear. If you suspect that your child has an ear infection, call the doctor. Doctors can treat ear infections with antibiotics. But doctors do not always prescribe these medicines right away because many ear infections are caused by viruses, not bacteria, and antibiotics do not kill viruses. Plus, many children get over ear infections without antibiotics. Doctors usually prescribe antibiotics to treat ear infections in infants younger than 2 years old. For children older than 2, doctors sometimes hold off on antibiotics. Your child's doctor might suggest watching your child's symptoms for 1 to 2 days before trying antibiotics if your child is healthy in general and the pain and fever are not severe. Treatment should be individualized based on your child's age, history of previous infections, severity of illness and any underlying medical problems. Antibiotics can have side effects such as diarrhea and rash, and overusing antibiotics can lead to more difficult to treat or resistant bacteria. Pain-relieving medicines, like ibuprofen and acetaminophen, may be used. But never give aspirin to a child younger than 18 years old. Aspirin can cause a dangerous condition called Ray's syndrome. Most doctors do not recommend treating ear infections with cold and cough medicines because these can have dangerous side effects in young children. Symptoms should improve within 24 to 48 hours. If your child does not improve after 48 hours or gets worse at any time point, call your doctor. If your child appears more ill than when seen by his or her doctor, contact the doctor as soon as possible. Children who are younger than 2 years and those who have language or learning problems should have a follow-up ear examination 2 to 3 months after being treated for an ear infection. These children are at risk for delays in learning to speak. Complications include tympanic membrane rupture and hearing loss. In addition to receiving the pneumococcal conjugate and influenza vaccines, interventions that help reduce the risk of recurrent infections include avoidance of tobacco smoke, breastfeeding, continuous low-dose antibiotics called prophylaxis, and or surgical placement of tubes in the ears. Thank you for listening. Subscribe to Diseases Simplified for more health tips and updates.